Hello, and welcome to the Department of Medical Assistance Services Financial Literacy 101. Because Medicaid finances are extremely complex, we would like to give you an overview of how our program is funded in Virginia. First, we will provide a background of who we are as an agency. Next, we'll move on to who we serve, who funds us, how we fund, and finally, Medicaid finance during COVID-19. To get started, let's take a look at who we are. The Department of Medical Assistance Services, or DMAS, is a Commonwealth of Virginia executive branch agency tasked with providing Medicaid health coverage for Virginians. The mission of the Virginia Department of Medical Assistance Services is to improve the health and well-being of Virginians through access to high-quality healthcare coverage. Finance and technology is the functional heart of Virginia Medicaid and provides the necessary resources so DMAS is able to provide high-quality healthcare coverage. Finance and technology is comprised of 6 divisions. These 6 divisions employ over 160 staff members who provide the technical skills and expertise to manage the medical budget of over $15 billion per year. The budget division completes the agency's forecast on November 1st of each year. The forecast covers a 3-year window looking into the future. This includes funding for all of the programs offered through Virginia Medicaid. Funding is a mix of federal trust funds, state general funds, and revenue collections. The Department of Medical Assistance Services budget is funded through a variety of sources, including Virginia general funds, federal matching funds administered by the Centers for Medicare and Medicaid Services, the Virginia Healthcare Fund, hospital coverage assessments, and provider rate assessments. For the official fiscal year 2021 forecast, this accounted for a total medical budget of more than $15 billion. This funding is used to serve more than 1.7 million Virginians through several different programs. All Medicaid members fall into one or more eligibility categories. To determine eligibility, visit coverva.org/screening. When Medicaid expansion occurred on January 1st, 2019, access to Medicaid coverage for Virginians expanded to cover new populations like childless adults and additional parents and caretakers. As of January 2021, over 500,000 newly eligible Virginians have enrolled. Once enrolled, members initially fall into one of 2 general categories: fee-for-service or managed care. Generally, members are initially covered directly by DMAS before being paired with one of the 6 managed care organizations partnered with DMAS in the Commonwealth Coordinated Care Plus or Medallion 4 programs. The vast majority of members are enrolled in coverage through one of Virginia's contracted managed care organizations, or MCOs. DMAS pays the MCOs a monthly payment known as a capitation payment based on the number of members they have enrolled and some characteristics of those members, such as age, gender, and locality. The MCOs use these funds to pay for all of their members' covered services. In most cases, they negotiate rates with providers, set networks, and use other tools to reduce costs, similar to private health insurance. If an MCO's profit from the Medicaid program exceeds a level set in the state budget, they return excess amounts to the Commonwealth. 2020 gave rise to unprecedented challenges for Virginians. The public health epidemic brought about by COVID-19 prompted a swift response by DMAS in order to ensure members have access to the care they need. Some of these items include no copays for any Medicaid or famous covered services, outreach to higher risk and older members to review critical needs, 90-day supply of many routine prescriptions, ensuring members do not inadvertently lose coverage due to lapses in paperwork, encouraging use of telehealth. Like many states, Virginia is facing a sudden, unprecedented budget impact due to COVID-19. DMAS adjusted to COVID-19 by providing additional financial resources for especially impacted providers. Many providers received additional funds to help cover their expenses during the pandemic, provide personal protective equipment, and to provide hazard pay for the additional risk they faced while serving our members during this challenging time. Virginia allocated additional federal dollars from the Federal CARES Act to DMAS to distribute to providers who supported our members during the health emergency. DMAS also worked closely with CMS to secure increased federal funding through emergency waivers and other opportunities to support our providers and reduce strain on the state budget. Virginia is committed to ensuring that these federal provider funds are used to prepare for, prevent the spread of, and respond to COVID-19 in communities that are most at risk for the spread of infection. Thank you for watching DMAS Financial Literacy 101. As you can see, there are many moving pieces to managing the finances of Virginia Medicaid. Medicaid financing is complex and nuanced, but we hope you found the video both informative and useful.